Hello all, I'm back again. I promised that we will start 7:05. I think this is 7:06. We're just trying to connect to YouTube so that we go on YouTube live. Just give us 1 or 2 minutes. My technical director will give us a go ahead. Are we set now on YouTube? We're live on YouTube. Great. Okay, so we will get started with the event now. I'm sorry, we have to mute your mics for obvious reasons. Some of you may have noisy backgrounds that you cannot control the noise. So we have to keep your mics muted till the end of the event. Then we'll be able to unmute you one after the other so that you can ask 2-3 questions and we round up for the day. So without much ado, let's get started. Let me just start the recording now. Give me a minute and I'll start the recording. Just checking out something. Good evening, ladies and gentlemen. My name is Boye Abe, and by the grace of God, I will be the facilitator for tonight's event. This is one of our online educational talks, and tonight the event is on prostate health, and I'm sure you all know the topic. When should I be concerned about my prostate? Like I said earlier, sorry, we have to keep you on mute. Tonight's event is organized by a group of entrepreneurs in the wellness industry. And the organization that is hosting this event is called Prosper in Health Association. Now, just like the name suggests, we help people to, like the name goes, prosper in our health, prosper in your health, and prosper while maintaining your good health. You see, a lot of people, yes, they prosper, but at the expense of their health. But our own is to help you to prosper without compromising your health and also prosper in your health. So tonight we're going to talk on prostate. It's a prostate health educational talk, and tonight's talk is titled, like you all know already, let's show you the title here. That's right. When should I be concerned about my prostate? When should I be concerned about my prostate? Okay, so my name, as always, Buya Bay. I'm a health and wellness consultant, and by the grace of God, I have 20 years to show for it. On the 31st of July, we make it the 21st year that I am into the health and wellness industry. So I think I know a few things about health and wellness. It's hosted on Zoom and is powered by Prosper in Health Association. Okay, enough of the introduction. Let's get on to the business of the day. Today, we're going to talk about some indicators, things that we need to watch out for that will give us cause for concern about your prostate. I understand that we have a lot of women here too, so we will be showing it from the women's angle too. You will learn more of that as we go on. Okay, so we'll be taking 10 points. I call them the indicators or the flags that you need to take note of so that when this happens, you know that your prostate needs concern. Okay? Well, the very first one is when you don't know jack about this thing called prostate. You know, a lot of people are so ignorant about it, it is uncanny. 2 weeks ago, when we did the first session, I shared a joke. Some people thought it was a fabricated joke, but it actually happened. I went to see a friend of mine in his office, and I noticed he was going to toilet a few times more than normal. So I just casually asked him, "Guy, how far with your prostate? What are you doing about your prostate?" Nice Christian brother. And the guy answered me, "In Jesus' name, I don't have prostate." I said, "Bros, you have prostate." I said, "Boy, in Jesus' name, I don't have prostate." My dear spirit brother didn't know that prostate is not the name of a disease. That prostate is actually the name of an organ. He thought prostate was a disease. So he was saying, "I don't have prostate in Jesus' name." So I just jokingly told him, "My brother, don't let me say amen to your prayers." Funny as it sounds, it shows how ignorant so many educated people are about their prostate gland. So we start up today's talk by making this statement: prostate awareness or ignorance is your call. Just 3-4 days ago, I was having a phone call, and you know, Google ads, if you are conversant with online advertising, you know what I mean by Google ads. Google ads just brought up an advert on Truecaller, and the image I saw on that advert was so shocking, I quickly did a screenshot. It's not only my own eyes that will see such an advert. Have a look at it. I did a screenshot. I couldn't believe what I saw. Can you imagine somebody actually saying, "No more prostates"? Can you imagine that? Advertising a product. Now look at the sheepish grin on the man's face that they are telling him that if you take this product, you would have prostate again. Can you imagine how ignorant our people are? These people believe that prostate is a disease. So they declared, "No more prostates." Interesting, isn't it? That shows just how ignorant our people are about the prostate gland. At least if you don't believe my joke, you will believe this one because this is live. Okay? So now, the real problem is that people don't know. But the worst problem is those that don't know, they don't know. They believe they know about it, but they don't know jack about the prostate. Then we have this other group of men. Yes, they do have knowledge of the prostate, but they are so nonchalant and complacent about it, and they say, "Hey, what's the big deal about prostate? Hey, boy, you are just a marketer. You are just trying to hype this thing up. What's the big deal?" Or like we say in the part of Nigeria I come from, "Kini big deal." Some of my foreign friends will be learning some Nigerian lingo. We have so many international friends. We have from South Africa. We have a lot of my friends from Kenya, and many of our guests too from Kenya. I welcome you all. We have some from Ghana. We have from Cote d'Ivoire, and of course from Nigeria. So you'll be learning. Some of our foreigners that are participants today will be teaching you some Nigerian jokes. Okay. So in Nigeria, we say, "Can a big deal?" What's the big deal about the prostate gland? That's how some men take it. You know, the real big deal is that you don't know it's a big deal. That is the big deal. How about our women? You know, because yes, a woman doesn't have a prostate. Some of our women say, hey, what has his prostate got to do with me? I mean, I don't have a prostate. That seems to be what my dear ignorant sister is saying there. If only you know that, yes, prostate disorders are a man's health issues, yes. But guess what? When the problems come, it becomes the woman's heartache. The woman will learn more of this as we go on. So why should even people be negligent, for goodness sake, ignorant or complacent about this, in the face of all the frightening medical statistics about the problems of this small organ? Let me show you a few things about it. You see my quotation that is on our ivy. I love that quotation by Benjamin Franklin, one of the founding fathers of the United States. He said, the only thing more expensive than education, folks, is ignorance. It's very expensive. Let me show you some frightening statistics. I mean, these are medical confirmed facts that you can go and cross-check yourself. It says there, prostate cancer, diagnosis of prostate is the second most frequent cancer diagnosis after lung cancer, and is the fifth leading killer in the entire world. Well, sorry, we don't have statistics of other countries, but I have for my country, Nigeria. They say cancer of the prostate is the number one killer cancer of Nigerian men. And these days is killing younger men. In those days, it was the elderly, in the 70s, in their 80s. But now we have men in their 40s, early 50s, in their 60s, already at advanced stages, stage 4 of prostate cancer. Is really, really terrible. So what should you think and say, what's the big deal about the prostate? Interesting. In Nigeria, we don't get too much of statistics, but I got this from the foremost hospital in Nigeria, the number one teaching hospital in Nigeria, University College Hospital, UCH, here in the southwest part of Nigeria. And you can see the statistics there, very frightening. The sites of cancer, prostate cancer make up 40.67, more than double all of them put together. Can you imagine that? That's how terrible it is. And I'm sure for those of you men in other countries, I'm sure it's also the same thing. Well, so let's first of all clear the air and give you this basic information, because it's quite foundational. What I'm going to share with you now will help you understand all the other things that we're going to learn tonight. So let me introduce you to your prostate gland. Yeah, that's the image of the prostate there. The prostate is an organ. I'm sure we know what organs are: heart, eyes, lungs, yeah, liver. But many of you can say a lot of things about other organs, but very few men know about this small organ called the prostate. So let me introduce it to you quickly. First, it's a gland. Now, what's a gland? A gland is an organ that manufactures its own fluids and secretes it within the body and to the environment. Well, actually, it's not just one gland. It's a group of glands, about 30 to 50 of them, all of them having ducts that put all the fluids together into a central reservoir. So I jokingly tell men, you actually have a juice factory inside your body. Okay, so, well, the next follow-up question should be, okay, you say it manufactures a fluid. What fluid does it manufacture? It manufactures a fluid called the prostate fluid. Now, this prostate fluid make up the bulk of what we men discharge when we ejaculate. The semen, the liquid the fluid we discharge into women. It makes up to 30 to 35% of that semen, or it's called seminal fluid. No gainsaying the fact that the prostate is very important for fertility of men. When it makes up the bulk of the volume of the semen, what do you expect? Then it controls a man's sex life, and like I said, it influences to a very large extent his fertility. Okay, So we're going to just go through the anatomy of the prostate very quickly. Now, if you look at this image, you see two tubes at the top. Now, those two tubes connect to the kidneys. That's how human beings are, both male and female. The kidneys drain liquid wastes through those tubes into that collapsible sac called the urinary bladder, or just the bladder. Strong muscles it has. Then underneath the bladder is a tube. Underneath that tube leaks the urine that is deposited by the kidney and comes out through the tip of the penis in men and through an opening in the vagina of women. Well, that is where the similarity ends. For men, as that tube that drains from underneath the bladder comes out from underneath the bladder, it passes right through the center of a ball-like organ. That is what is called the prostate. It's like a ball. Imagine a ball with a hole inside it. Yeah, that tube that drains urine passes right through its center and comes out at the tip of the penis. Now, another tube comes from the testes. That's the factory downstairs there. The tube is called the vas deferens. It comes from the testes. It goes and joins the tube coming from the bladder. That's why I call it the perfect plumbing system. It's only God that can design such a perfect system. It comes from the testes, joins the tube that is coming from the bladder right inside the prostate, and both of them drain out as one tube out of the penis. You can see it there. That's a tube coming from the bladder. The one that you see coming from the left is the one coming from the testes. It joins right inside the prostate there. And you can see both tubes now become one tube. And that single tube passes out through the tip of the penis. That is the structural difference in the anatomy of the urinary system of men that is so different from that of women. Now, please hold that thought there. Remember, I said the tube that drains from underneath the bladder passes right through the center of the prostate, and another coming from the testes joins it inside the prostate, and both of them drain out as one tube. Hold that thought there. We'll come back to it. Okay? Because that same tube, I keep calling it a tube, it has a name. It's called the urethra, or just call it a urine tube. That tube does a dual function. It drains urine from the bladder, and it also drains semen from the testes. That same tube. So God, in his wisdom, put in valves to regulate and control the flows so that urine and semen do not come out at the same time. Now, these valves, they're actually strong muscles. They're called sphincters. They control the flow of those two fluids. Just hold that thought too. We'll come to that shortly. You can see them there. You can take a snapshot if you like. They're called sphincters. There are two sets of sphincters. One is called the upper internal sphincter. That's the one controlled by the brain. That's the one that prevents us from urinating in our trouser when our bladder is full. Those sphincters hold the urine back so that we don't wet our pants. It's a reflex action. We don't control it. But the one called the external sphincter, or the external lower sphincter, is the one women have voluntary control over, that we can hold those sphincter when or if we don't have the convenient opportunity to urinate. We hold it back. That is the one we can control, the external sphincter. I remember one of my participants at a WhatsApp session, he just interrupted my training. He said, Oga, let's just call them prostate padlock. Very funny, but so apt. They are called prostate padlock in quotes because they actually hold the fluids, both the semen and the urine. Those two sphincters, those two pairs of sphincters. We'll come to that later. I just needed to introduce that to you at this point. Well, the next thing is, okay, now we know the anatomy of the prostate. Hey, where is the prostate? I did a seminar at U. One staff of Shell, he said he's an engineer with Shell. He came to the front when I asked them, can somebody in the audience tell me where your prostate gland is? This man came out proudly and just touched his chest. That was where his own prostate is. Well, just in case you don't know where it is in your body, that's a good artist impression of where it is located in your body. Actually, from its name, you will know its location. The word prostate is from the Greek word prostatis. In literal English, it means one who stands before. So that is the exact position of the prostate. If you view from the angle of the tip of the penis, the prostate stands before the bladder when viewed from the tip of the penis. So that gives you a very good, knowledge of its exact location. It's between the penis and the bladder. And one very popular test to know where the prostate is located is called a rectal examination, where a trained finger is pushed into your anus and it can actually touch your prostate because it's very close to the rectum, and they can actually feel your prostate. That's the physical examination of the prostate gland. A lot of men run away from that medical examination. It's so uncomfortable and embarrassing having somebody stick his finger up your where. Okay, so most men feel quite embarrassed to do the rectal examination of the prostate. But just for the purpose of this study, that's a very good way to know its physical location. Okay, the second thing that should get you concerned about your prostate is when you don't know what it is for, when you have no idea of the purpose of the prostate. I like the quotation from the popular motivational speaker, Miles Monroe. He says there, I quote, "When purpose is unknown, abuse is inevitable." And really, that's, I think, is the fundamental reason why a lot of people have problem with the prostate, because they just don't know what it's for. Now, when you don't know what it's for, how can you know when it goes wrong? So very quickly, I will educate you on the 4 key functions of your prostate that every man must know. So very quickly, the first major function, and indeed that is the main function of your prostate, is for your reproductive health. I mentioned it earlier. It produces the prostate fluid, the main fluid that makes up what we discharge inside a woman. Well, the semen is made up of more than just the prostate fluid. It collects fluid also, that is the prostate gland, from 2 neighboring glands. Then it also collects the seminal fluid from the testes. Now mixes all of these fluids together. So I call it the master mixer. It's a woman that will understand that, how their kitchen blender mixes all the ingredients together. The prostate mixes all of these fluids together. Then the prostate's strong muscles violently contract and they push out the semen through the urethra, out of the penis, and deep into a woman's vagina. You can see how important the prostate is for reproductive health. Then inside the prostate fluid is an enzyme, a protein called PSA, prostate specific antigen. It's a protein that provides nourishment for the sperm cells. It also provides an excellent alkaline environment for sperm to swim into a vagina because they pass through acidic regions. The first acidic region is the urethra that passes urine normally. Well, the PSA provides a neutralizing alkaline environment so that the alkaline environment of the urethra will not kill the sperm cells. Then it also provides protection. I call it like a bulletproof protection for the sperm cells to pass through I call it the danger zone inside the vagina of a woman. Please, women, don't have my head for that. Every woman has a very acidic outer vaginal area, and God did that deliberately because a woman's vagina is open to the outside world, and that makes women more susceptible to infection. So God had to make the outward part of a woman's vagina to be very acidic so that it will kill bacteria and other germs on contact so that they don't enter into her. Well, that acidic environment is not conducive for sperm cells. So the PSA forms like a bulletproof vest, if you like, so that the sperm cells can pass through that danger zone to the egg where they are going to fertilize it. So you can see how important the prostate is for reproductive health. Then it controls sexual health. Why? Because it has two nerves on either sides of the prostate called the erector nerves. They control the nervous impulses that send blood to the penis. We all know the penis is all muscle, no bone. What gets it harder, stay hard, is a good supply of blood that stays in there for the job to be done, and it goes back to the bloodstream. Okay, so the erectile nerves play a very important role. Then, because the prostate is responsible for violently contracting to push out semen, and women know that it is the time of orgasm, the time of ejaculation, that is the height of sexual pleasure. So a man with weak prostate will not be able to pump the semen out with enough force to give him enough sexual excitement. So they don't really enjoy it when they ejaculate because there's not much force. And still talking about the force of ejaculation, a lot of men are challenged in this area because the prostate muscles are not strong enough to push the semen out deep into a woman's vagina. So we find out that when that happens, the semen leaks out because it's in the outward part of her vagina. So when she stands up after sex, the semen leaks out. We'll come to that later on. Okay? The third function is urinary and semen control. Remember I told you the testis has a tube, the vas deferens, that connects the tube coming from the bladder and the drain as one. Well, God in his wisdom put valves there to regulate and control the flow of these two fluids. Regulate and control are two different meanings. Imagine a T-junction and we have a traffic light there. Now, regulate means that it directs which of the two fluids will pass. Is it semen or is it urine? Then control means that if it is allowing semen, it decides when semen starts flowing and when semen stops flowing. And if it is allowing urine, it determines when urine starts and when urine stops. You can see the power of those muscles called sphincters, two sets of muscles that regulate and control the flows. A malfunction in this area is what causes men to have premature ejaculation. A malfunction in this area is what causes men to have urinary incontinence, where they cannot control urination. You can see how all of these functions lead to is malfunction. Lastly, it just does the job of sanitizing the entire urinary system. The prostate serves like a sieve to sift out toxin, dirt, and other impurities from damaging the sperm cells. It helps to sift them out of the system. You know, ironically, this is one of the problems of the prostate. Do you know why? Because we don't just stop eating junk. So the prostate has a lot of work of cleaning up the system, and eventually, guess what? It packs up. That's why you need to be cautious on what you eat. So these are the 4 key functions of the prostate gland. The third reason why you should be concerned about your prostate is when you get to the age of 40. You say, Mr. Boye, what do you mean 40? What does 40 have to do with prostate? It's not me that said it, it's medical science that said it. Prostate disorders are ubiquitous in men 40 years old and older. This is a medically confirmed fact. Scientists have found out that the incidence of prostate problems have more frequency in men when they are over 40 than in those who are under 40. That age of 40 just happens to be that trigger age in men. And we found out that the body ages as you age. For some people, their body ages faster than they age. So for some people, although they are 40 chronologically, their organs are 70 years old. You see, there's a difference between age and aging. And we need to realize that your body ages as you age. There are two ages that are important for you to note. Your chronological age, that's the one we mark with birthdays. But there's another age, your biological age, the age of your internal organs. You can be 25, but your eyes is 60 years old. Your kidney is 45 years old. So when we say the magic age is 40, we're talking chronologically. For some people, it's when they're 25 that their prostate is 40 years old. And don't take my word for it. Go and find out. The body breaks down as you age. Different parts of the body, as I'm scrolling, you will see it there. All of these parts of your body break down with age. It's not sickness. It's just called aging. So don't just look at yourself in terms of your age. Look at yourself in terms of the aging process that takes place. They say life begins at 40. If you know what some of us know, you will know that life doesn't begin at 40 at all. And when you realize that aging takes place, then you need to be more cautious and conscious of what you put in your system. To realize that as you are growing older in age, your body is also aging. You will learn to slow down and you will learn to increase the level of your discipline, especially on what you eat. You see, the psalmist realized that. They realized that. They prayed a very important prayer to God. Excuse me if you're not a Christian, but this is a very important prayer. It's in Psalm 90, verse 12. They said that prayer to God. So teach us to number our days, to realize we are growing old. Why? So that we can apply our hearts to wisdom. If I speak it in Nigerian palace, teach us, God, to know that we are growing old and borrow us some sense. That's how we say it in Nigeria. Borrow some sense. If you see somebody not acting wisely, you say, bros, go and borrow some sense. We need to borrow some sense. As we grow old, we need to realize that we can't just eat those stuff that we used to eat when we were younger. Your body cannot take them anymore. You need to exercise discipline, and it comes to your prostate. Okay, look at the statistic. I got it online. Look at that graph. Percentage of prostate disorders plotted against age. See what happens when the man is getting to 40 and above. The incidence of prostate disorder seem to increase with age. Age is a very important thing, or to be more precise, aging is a very important thing, especially the age of 40. And that leads me to the next point. What happens to men at 40? That's the next thing you need to find out. That landmark age, when something happens to a man's hormone system. Marked hormonal changes take place when he gets to the age of 40. That leads to me the next thing. The next reason why you should be concerned about your prostate is not just when you reach 40, when andropause sets in. Andropause is the name given to the hormonal changes that happen in men. Just like in women, for women is called menopause. Now this comes as a big surprise to so many men. You say, wait a minute, boy, are you trying to tell me that we too go through menopause? Yes, we do. Ours is called andropause. Now look at this interesting graph. The brown represents the level of the main hormone of men called testosterone. It's the main hormone in charge of a man's sex life amongst many other medical uses in his body. That's the one in brown. Look at what happens when he's a teenager. You see he's dropping in his 20s by half level. Look at what happens when he's 80 and above. No more testosterone in his body. Testosterone production drops with age, especially from 40. Actually, to be more precise, it doesn't just disappear. You know, the way we say it is as if testosterone just vanishes in his body. No. Testosterone is the main hormone that controls a man's sex life. Testosterone, that's the name. But it doesn't just disappear. What happens is that as a man ages, testosterone gets converted into another hormone called dihydrotestosterone. Don't bother about that name. Just call it DHT. It gets converted into DHT. Now, medical science use the word unfriendly to describe DHT. But I will use the Nigerian palace that we call area boys. For our foreign guests, let me explain what I mean by area boys. I'm sure you have them in your country too. Area boys are street urchins. These are unruly, most of them uneducated guys that are hired by politicians to foment trouble. Okay, they are thugs and they just cause problem. So we call them in Nigeria area boys. Well, I call DHT the area boys hormone. Do you know why? Because when testosterone gets converted to DHT, medical science tells us that DHT goes straight to your prostate cells and cause like a riot there. It induces rapid cell multiplication. It's called hypertrophy. Rapid cell multiplication that causes an enlargement of the organ called prostate. So you see what happens is not that testosterone just disappears. It gets converted to DHT, and DHT causes problem for your prostate. It causes the cells to start growing rapidly. Now you understand. That leads me to the next point. The next point is, what makes that happen? The next indicator. From 40, the prostate starts enlarging. And that is the reason why you should be concerned when you reach 40. Because of that cell multiplication caused by the conversion of testosterone to DHT, the prostate starts enlarging. Remember, I taught you at the beginning the anatomy of the prostate. The tube that drains urine from the bladder passes right through the center of the prostate. So when the prostate starts enlarging in size, it starts squeezing that tube. Take a look at the image on the left there. That's a normal prostate. The bladder is on top. The prostate is wrapped around it. But what happens? Look at the second image. Urine, you see that arrow there? Urine flows freely, no problem. But what happens when it starts enlarging? Look at the second image. The prostate starts squeezing that tube. Now, urine flow now becomes problematic. Can you see the arrows, the yellow arrows? The tube now starts getting constricted, starts compromising the flow of urine, and of course, the flow of semen too. And you see urine is no longer coming out from the bladder as a ought to. But because you don't know that something happens when you get to 40. So the enlargement continues unabated. And see what's happened there. It squeezes the living daylight out of that tube. And a lot of men don't know. They're totally oblivious that this is going on in their bodies. I was talking to a man about this. He said, no, I don't need anything about my prostate. I just shook my head. If only you know what is happening to you. You are 55. If only you know the enlargement that is going on in your prostate, you will thank me for inviting you to come and learn why you should be concerned. Like I jokingly tell men, the only people eliminated that what I'm saying about age 40 doesn't concern them are people who are sure that they will not live till 40. So if you are not yet 40 and you are sure you will not get to 40, maybe this part of this training is not for you. Just kidding. But you get the idea of what I'm saying. Once you get near or attain the age of 40, please take notes. Whether you know it or not, whether you believe it or not, whether you agree with me or not, your prostate will surely enlarge. Case closed. And like I put there, prostate enlargement is problem enlargement. That is the trigger of challenges of the prostate. Hey, it's not every man that his prostate enlarges that gets to a problematic state, but that is the springboard of the disorders of the prostate. Another thing that causes challenge with the prostate and aging is cell damage. Still related to aging, cell damage takes place due to the activities of what is called free radicals. Let me do a little bit of some biology lesson very quickly. Every organ is made up of cells. Every cell has a nucleus. Inside every nucleus are atoms. Inside the atoms, they have electrons, they're in pairs, positive and negative. Unfortunately, there are some atoms that their electrons are not paired. That is, they don't have the positive and the negative charge. They are called unpaired electrons. I think I have the image there. Yes, they are unpaired. Now, these are the ones called free radicals. Now, what happens is that once they are unpaired, they now look for other atoms to go and steal their own electron so that they can be paired, so that they can have their positive and negative. So they dart around the body, going to cells and picking the atoms there and stealing the electron of those atoms. So I just call it electron thieves. Just call it, don't call it free radical, just say electron thieves. They go around stealing electron so that they can be paired. Am I communicating? Now, when they do that, the atom that they stole electron from now becomes a free radical too. It too goes to go and steal. So the domino effect of electron stealing collapses the organ itself. Bam! What's the solution? It's called antioxidants. What are antioxidants? Antioxidants come in and donate their own electron, like we say in Nigeria, to settle the quarrel. The problem is that there's electron shortage, right? Okay, let's come in and donate our own electron and settle the quarrel, like we say in Nigeria. So that is why, as you are growing old, you need to be taking antioxidants. Why? Because as you age, a lot of free radical damage is taking place inside your body. You need to use a lot of antioxidants to neutralize the dangerous activities of free radicals. Another thing that can cause cell damage is when the cells don't get nourishment. That, look at that image on the left. It sounds like an irony. People are overfed, but they are also starving to death. Why? Because they're just eating food that is lacking in nutrients. Okay? Hear the words of the two-time Nobel Prize winner, Dr. Linus Pauling. He says there, nearly all disease can be traced to what? Nutritional deficiency. Okay, so make sure that it's only food and drinks that contain nutrients that your body needs, especially your prostate, and avoid the ones that don't. We'll come to that at the later part of the talk. Okay, so that takes me to the next point. Number 6. The next indicator that should get you concerned about your prostate is when the problems start. When there's a problem down there. Well, it's a bit late, but at least you should start taking note when the problem starts. That's why I took time to explain what can trigger the problem. It's not just a lecture, so that you will have a deep insight. What can trigger these disorders? Well, let me just summarize. First of all, aging. Remember, not age now. Aging of man, especially from 40. The second one, hormonal imbalances, low testosterone. Medical science call it low T. That's the nickname they gave it, low T, low levels of testosterone hormone. Okay, and the third one is cellular damage and cellular malnutrition. These are the triggers of prostate disorders. Okay, I'm very careful with the use of my words. Okay, because medical science have not been able to adduce a particular reason for prostate problems, but I just call these triggers. Just like a trigger of a gun pulls out the bullet. A loaded gun is not dangerous until the trigger is pulled. So these are the triggers of prostate disorders. Okay, so you need to know them, you need to prepare for them, you need to prevent, and of course, if you're already having the problems, you need to arrest them, so that we won't be talking stories that touch the heart. A word is enough for the wise. That leads me to the next point. Well, boy, this is one area that I need to hear. I can hear a few of you saying that. The disorders of the prostate. When should you be concerned? When the disorders happen or when you don't know about them. So let's talk about the disorders of the prostate. There are three main types of prostate challenges. The first one is called pronounce it well, prostatitis. Prostatitis. Just pronounce it, prostatitis. Okay? I'm just teaching you some medical jargon now. Prostatitis. Now, prostatitis is an infection of the prostate that causes it to be inflamed, that is, gets bigger in size. Not really an enlargement, just an infection that causes an inflammation. And you know, anything inflamed gets bigger in size. Okay? The next prostate disorder is the one called benign prostatic hyperplasia. Now, that's another tongue-tying name. I'll break it down shortly. That is an enlargement of the overall size of the prostate. The word benign actually means non-cancerous. Hyperplasia means rapid multiplication of cells. So put it together, non-cancerous, rapid multiplication of the cells of the prostate. The third one, the dreaded cancer of the prostate. Actually, cancer is cancer anywhere. It's just where it is localized that gives it its name. So when they say cancer of the prostate, it's just the same cancer. It's just that it is in the prostate gland. Okay? And that is the multiplied growth of abnormal cells of the prostate. Okay? Now, so these are the three main disorders of the prostate. I have a footnote here. Prostate disorders is not a cause, but it has no known medical cause. I have a few clients that felt, you know, Africans generally, not just Nigerians, were very superstitious and we believe in the mystical world. You know, one man actually told me that, look, he believes that it's his wife that is the one that is sending arrows. Don't ask me what type of arrows, to his penis, because of his girlfriends that he's having around, that his wife is the witch that is causing problems with his male organ. I just smiled. I said, sir, this is not a problem of somebody sending arrow. You are having prostate disorder, sir. Bottom line. Then the second thing I want to say about this is that they are mutually exclusive. What do I mean? The fact that you have prostatitis doesn't mean that you will have cancer. So please don't start writing your will yet, because the doctor diagnosed you that you have prostate enlargement. A lot of men get scared when they hear prostate enlargement. Yeah, I'm going to die. No, please don't start writing your will yet. You are not going to die because you have enlargement. One doesn't lead to the other. They are mutually exclusive. You can actually have prostatitis and also have BPH. Okay? It doesn't mean you can't have two, but they are mutually exclusive disorders. Okay? So those are the 2 points that you need to know about it. It's not a cause, so don't think anybody, one old baba in the village is sending arrows to you. No, it is your prostate malfunctioning, okay? All right, so let's look at it very quickly. Prostatitis, I mentioned it, is a swelling and inflammation of the prostate gland. It's usually caused by bacterial infection, although there are some other known medical causes. It can be bacteria from other infected organs, like the gallbladder for some people, you know, or it swims in the bloodstream, comes to the prostate. It can be of the kidney, just a bacterial infection that finds its way to the prostate and causes it to get inflamed. But in most cases, it's a bacterial infection that comes through sex, STDs. 7 out of 10 people with prostatitis, if you ask them, they have a history of sexually transmitted disease. And we have this problem the world over now. It's called antibiotic resistance. There's a lot of resistance with the strains, the mutated strains of bacteria that is out now, that they are resistant to the known pharmaceutical preparations to take care of infection. So that's why some people keep on treating infection over and over again, because the strains available now have mutated that they are resistant. You can Google it yourself. Just type on Google antibiotic resistance. You see, even World Health Organization is concerned about what is happening now, that the bacteria out there now, they are so resistant to the known antibiotics around. Okay, so we have people that have treated STDs over the years, but they've just built stronger, more resistant strains. Well, the second one, BPH, benign prostatic hyperplasia. Remember, I told you it is non-cancerous and it's just rapid multiplication of the cells of the prostate that causes it to be enlarged. That's the normal prostate on the left there. Look at an enlarged prostate. Well, prostatitis happens in younger men from about 25 to about 40. We have BPH happen that is more prevalent in we older men from 50 and above. Okay, although these days we're having young men experiencing BPH, young men under 35 are already having symptoms of BPH. Okay, your prostate enlarges as you age. For some, it enlarges faster than you age. The third one, most people don't like me talking about this, but we have to still talk about it anyway. The cancer of the prostate. Now, that's the one that is caused by, attack of the prostate cells. They've not been able to adduce a particular reason to it, but they query free radical damage as one of the likely causative factors that causes abnormal growth of the cells of the prostate and leads to cancer. This one is what a lot of people need to avoid. Unfortunately, it's killing so many men. The eighth indicator that you should start taking note of, that will start giving you concern about your prostate, is when the problems of the prostate starts manifesting. I call it the red flags, and I've been able to group them into two: bedroom challenges and bathroom challenges. Okay, my images there tells you more than my words. This is not a medical classification. I need to put a caveat there. This is just the Boyabe classification to be able to explain it to the layman audience. Okay, so the real problem is that most people don't know when a problem is a problem. That is the real problem. They're experiencing the problem, but because they don't know it's a problem, that is the real problem. So this is when you should start getting concerned. And we're going to take a chronological review of these first group of problems. The one of the bathroom, I call it bathroom challenges or urinary problems. We'll take a chronological review of urinary challenges symptomatic of prostate disorders. What do I mean chronological review? We're going to start with the first signs. the very initial signs of prostate disorder. Then we will progress and we will see the deterioration as it goes on. Please fasten your seatbelts at this time. Men, please be very attentive, especially when you're already experiencing some of these symptoms, and some of you don't even know that it's a prostate that is malfunctioning. I have several men, countless calls of men over the years, that it is at my seminar that their eyes opened to the challenges that they've been having, that they were totally oblivious of the fact that it was their prostate. So let's start a chronological review. Let's start with the first group of urinary challenges. They're called voiding problems. What does voiding mean? Voiding is a medical word that describes the release or the expulsion of urine. Let me just call it in our local Nigerian English. Pissing problem. We call it piss here, to urinate. Okay, so let's say the pissing problem of the prostate, or let's get very refined, voiding problems. Let's start with the simplest one. It's called reduced urine pressure flows. Remember, I told you, as the prostate enlarges, it squeezes the tube that drains urine. A lot of men don't know this. The pressure of urine as they urinate is reducing with time. They don't realize this. Look at this image. From number 1 to number 5, you can see there's nothing showing number 6. Why? Because he's already urinating on his clothes. He's already urinating on his shoes. He's already urinating on the floor. It's called bladder outlet obstruction, BOO, where the outlet of the bladder, where it enters into the tube, is being blocked or constricted by the enlargement of the prostate. And it's a slow process, so slow that most men don't notice it. Check out when you are urinating. Do you soil the toilet seat when you are urinating? Can you compare the pressure of your urine to that of your 7-year-old son? You see, when they urinate in sand, it will dig a hole inside sand. But when you urinate, we men, we miss the toilet bowl. We spray the seats. I overheard 2 women conversing some years back. I think one of them hosted her husband's friends for a party in their house. And she was complaining to her friend, "Well, I will never allow my husband to do any party in the house. If you see how all his friends just messed up my toilet, they were just urinating everywhere. The whole of the floor was full of urine." I just shook my head. Ignorant woman. If only you know that your husband too has that problem. It's because they can't aim well anymore. It's not their fault. When I go to public toilet and I see urine all over the floor, I just shake my head. Oh dear, men have problems with their prostates. That's what is called BOO, bladder outlet obstruction. Then we have the next one. It's called terminal dribbling. You finish urinating, but urine still drops. Women call it ringing the bell. I'm sure the men listening will smile when they hear this, because we all ring the bell, especially we older men. But the thing is that some men ring their bell stronger and longer than others. You know what I mean? The urine still drips. And in some cases, we have what is called the residual urine volume. Long after he has left the toilet, a large volume of urine just comes out unannounced. Boom! His trouser is wet. The map of his village is already on the trousers. Imagine coming back into management meeting and the front of your trouser is showing the map of your village. It can get very embarrassing. That's residual urine volume. Then we have the one I call ETC, others that are related to that. Like, for example, when you have multiple urine streams. Urine is supposed to be one stream, but for some people, you see, because the prostate is pressing hard on that tube, the urine comes in 2 or more streams. Try pressing the mouth of a rubber hose that is draining water. You will understand what I'm trying to say. The urine comes out in multiple streams. One man told me I urinate is like shower. I understood what he was trying to talk about. Then for some, they experience breaks in urination. The urine comes out in spurts. It comes out, stops, starts again, stops. Unusual urinary patterns like that. Then we have the third one, urgency. You cannot hold urine anymore. The sphincter cannot hold anymore. You just must pee. There's a man, he kept an empty plastic bottle under his car seat. Do you know why? Because anytime he's in the chaotic Lagos traffic and he feels like urinating, he cannot hold it. He just must pee. So he brings out the pennies, regardless of whoever is in the car with him, urinates inside the bottle and puts the bottle back under his seat. That's the problem with the prostate. That's the first group. If you want to avoid this, or you're already experiencing this, please talk to a partner who invited you here today so that it doesn't get worse, because it can get worse. Worst voiding problems is when you get to the toilet to pee, you wait there 1-2 minutes, urine is not coming out. I was in Sheraton Hotel the other day. I went to use the toilet and I met a man there. I finished urinating the urinals. As I was going out, the man hadn't even started urinating. I just shook my head. This man has a problem with his prostate. When urine is delayed to start, the pipe is blocked. It's getting blocked. Delay, hesitancy. It gets worse. You start feeling pins and needles, peppery sensation on the shaft of the penis. It gets worse. That's the infection setting in. Or it can become excruciating pain, where urinating becomes a serious, painful process. Are you experiencing any of this? Or would you rather wait for an experience? One man told me, boy, thank God, I'm not experiencing any of this. Do you want to wait for an experience before you take care of your own prostate? That would be very, very foolish. Then some discomforting voiding problems, when you have to wake up 3, 4, 5 or more times before daybreak just to go and pee. If that is your experience, gentlemen, please take note. It is not normal. A lot of men, they try to live in self-denial and try to explain it away. Oh, boy, I drink a lot of water at night. That's why I wake up to pee. Okay, don't drink water at night. If you are waking up 3, 4, 5, 6 times before daybreak to go and pee, there is a problem. Medicine calls it nocturia, frequent nighttime urination. It's one of the most common challenges of the prostate. Seek help before it worsens. It also happens with daytime urination. I did a seminar in my church for the choir in my church. They were having a health week, and they called me to come and speak to them in the choir. And I talked about this. One woman walked up to me after and said, her husband wakes up during the night frequently to use the toilet. And women, you like putting 2 and 2 together, and you get 22. She thought her husband was going to chat with girlfriends in the middle of the night. So this day, she said, she pretended as if she was sleeping. As usual, the man woke up to go and pee. Thinking he was going to chat with his girlfriend, the woman waited, and she was tiptoeing to the toilet to go and catch him red-handed. You know how you women are? To go and catch him red-handed in the toilet, God just made her eyes look at the dressing table. And lo and behold, the husband's phones were on the table. This woman was shaking. He said, sir, please come and help me. My husband wakes up to 5 times. We didn't know it's a problem. Ladies, is that the thing in your home? Is your husband disturbing every night, waking up 3, 4, 5 times to go and pee? Ladies, is your husband's underwear smelling of urine or even damp with urine? Maybe he's leaking urine. Just maybe. It gets worse to urinary incontinence, where you are now having a problem with urination. The urine comes out unannounced. Urine leaks. It gets worse. Before you get to the toilet, the trouser is wet. You get to the worst case scenario, total loss of control of urination. The man starts wearing diapers. I don't know about other countries. Those of you listening to me that live in other countries, I don't know about your country, but here in Nigeria, adult diapers sell more than children's diapers. In fact, they don't even hide it anymore. Go to any neighborhood supermarket and ask for adult diapers. They put it near the children's diapers. That is what is happening now. Our men are losing total control of urination, so they have to wear diapers. And just in case you don't know, diapers are meant for babies. The next set of problems, discomfort and pain. I told you we're going in a chronological order. We started with the simplest one. It's getting worse now. You start experiencing pain, lower back pain. It's called CPPS, chronic pelvic pain syndrome. It can get worse to the acute pelvic pain syndrome. Pelvic pain, pain around the groin, pain around the scrotum, pain around the shaft of the penis, pain in the testes, pain in the lower back. Does this resonate with any of you listening to me? Ladies, do you notice your husband every time holding on to his couch? A lady told me, said, you know, after I listened to your seminar in the bedroom, we don't switch off the lights anymore. I squeeze my husband's penis and I look at his face and I do as if I'm playing with his penis. I squeeze it and I look at his face just in case. That's a wise woman. That's a wise woman. The next set of problems, bladder storage problem. The prostate is still squeezing that poor urinary tube, that urethra. It's still squeezing it. So what is happening now is that the bladder is not draining urine out as efficiently as it used to. The bladder that is supposed to take between 25 to 35 cl, a Coca-Cola bottle worth of urine, is now being forced to take 1.5 to 3 liters of urine. The bladder muscles get stretched because it's taking more urine than it was designed to take. The muscles are now weak. The man goes to the toilet to urinate, but because there's still urine in the bladder, he has this full feeling even after urination. That is what is happening, because urine is still there. So you still feel like urinating even after you have finished urinating. Is that you? It's called incomplete emptying. It gets worse, gentlemen and ladies. Now look at these two images on the right. A cross section, look at the arrow around the bladder. You see the arrow of the first image. Nice, healthy prostate. Urine is going out normally. But look at the one on the left. The prostate is enlarged. It has squeezed the urinary tube, the urethra. Urine is now retained in the bladder. Urine retention. Urine now stays longer than it is supposed to stay inside bladder. And remember that urine is acidic. It's not meant to stay long in the bladder. So what happens is that when urine stays longer than necessary, it provides a very conducive environment for bacteria to grow inside the bladder. So infection sets in. The problem starts getting alarming. Am I trying to scare you? How I wish I was just hyping this up. How I wish I have not met men in my years on this subject that have experienced all of what I'm teaching you. You know what happens? Bladder infection sets in. And because the bladder is connected to the kidney, kidney infection sets in. A lot of men wonder, but the problem they have is prostate. How come it's now kidney problem? Because they're connected. Because the infection of the bladder caused by retained urine has already polluted your kidneys. Then it gets worse. Retained urine, because it contains minerals. And the minerals, you're supposed to have excreted them. But because they're still there, the minerals start crystallizing. So the urine start forming little stones. Little stones. It starts crystallizing. I did a seminar for a neighborhood association, one elderly man. Oh, the man's statement touched me so much. I just remembered now. This man spoke in my local language, Yoruba. He said, "Montoyekbe," translated in English, "I'm urinating sand." Oh, I was so touched. Elderly man. He said, "I am urinating sand." Of course, I knew the problem was. His urine was already forming crystals. And you know what happens? When these crystals get bigger, they start abrasing the wall of the bladder like sandpaper. Abrasing the walls, and the bladder start bleeding. Hamartospasmia is what is called when blood mixes with semen. I call it bloody semen. Again, at a seminar, a woman ran up to me shaking. 6 months before, she just had sex with her husband, went to clean up in the toilet, and as she was douching, she just saw blood on her hands and her fingers. And she said to herself, "Hey, I'm not menstruating, what's the problem?" She dipped her finger deep inside her vagina and scooped out the husband's semen. And she said to me in Yoruba language, "I saw blood inside his semen." Meaning that it wasn't like the blood smeared on the outside. She saw the blood inside the semen. She heard of hamartospasmia for the first time. But when that happened, she told her husband, and the husband dismissed it. "It's your menses," and they left it there. Fast forward 6 months later, she hears of hamartospasmia. Panic. She called her husband right there and then. "Remember, my dear, that time that I had blood inside me, they have explained it. You have..." Oh my God. Ignorance is very expensive. The stones get bigger and bigger, and they block the outlets. Suddenly the man wakes up, he wants to urinate. Sorry, urine is not coming out anymore. Blocked bladder, like they say in sports. Game over. He is rushed to the hospital to go and pass a scientific apparatus to drain out urine from his bladder. It's called the catheter. That is the problem that happens. Do you want to wait till all of this? There's more. Let's move on to the bedroom challenges of the prostate. Like I said there, if matters of the other room matter to you, let's discuss the matter now, here and now. If you are going out of order, thankfully, many of my guests that I invited, they even told me before today, "Sir, something is going wrong down there." I said, "Just join me tonight first. We'll talk about it after." If you are listening to me and there's a problem down there, you don't have to be ashamed. If the matters of the other room matter to you, you better let's discuss the matter. So, for our foreign guests, I need to explain what other room means, because a lot of my foreign friends told me, "Sir, what does other room mean?" So let me explain the joke of the other room to you for our foreign partners. The Nigerians listening to me already know what other room means. But other room is a slang, a Nigerian slang, that was given to us by no other person but the president of our country. When he was interviewed abroad, And a foreign journalist interviewed him abroad, and he said that as the role of his wife, his own perceived role of his wife, the bedroom. She said the other room. So since then, Nigerians have been referring to the bedroom as the other room. So my foreign friends, you're learning a few of our Nigerian lingo here now. Other room. So tell your friends in your country that you've learned Nigerian slang. We call it other room in Nigeria. So let's see what happens in the other room. Other room challenges, of course, we've mentioned about andropause earlier. Andropause, where testosterone level drops. The medical name is hypogonadism, but don't bother yourself about the big name. Just call it by its popular name, low T, or low levels of testosterone. Now, testosterone is the main sex hormone of man. It's what determines his overall sexual health, erection, libido, stamina, everything that has to do with a man's sexual life is controlled by the hormone called testosterone. So when testosterone drops, of course, you know where it will be evident, in the other room. Okay? So, of course, the first place where you see andropause show up is the man downstairs. And you can see there the rise and fall of man as he moves from 20 to 30 to 40 to 50 plus, it falls. Okay? And I have this funny image I shared 2 weeks ago where we did this seminar, erectile dysfunction. You can see the horse there, ridden by the woman there. As the horse ages, the rider is having more and more challenges riding that horse. You say, wait a minute, boy, this is not a horse. I think it's a horse. If you are not seeing a horse, I think you need to be born again, because I can see horse. I don't know what you are saying. So the horse is gradually going out of action as it ages. You get the general drift. Okay? So summary of common low T symptoms. You can see a summary there. Low libido, male infertility, erectile dysfunction. We have erratic sleeping patterns. Then weakness, general weakness. Then mood swings, erratic mood swings. Okay? These are just some common symptoms of low T. But let's look at some unusual symptoms. They call it midlife crisis. In the 50s, something happens to men, midlife crisis. We have longer refractory period. What does that mean? Interval between orgasm. Between the last time he had an orgasm and the next time he has one. Some men can't even remember. Some haven't had sex with their wives in years, yet there's no quarrel. Then reduction in testicle size. Their testicles start getting smaller. Then we have reduction in semen volume. We found out that the semen they discharge, the volume just reduces. No, testosterone is dropping, and it's part of the hormones that is the hormone that stimulates spermatogenesis, the production of sperm and semen. Then reduce body muscle and body mass. The mass just starts shrinking. Mood swings and depression. Even suicidal tendencies have been traced to low levels of testosterone. One lady said, maybe this is why my husband is always moody. I said, please, I can't answer that one. Don't let your husband hang my head. He said, one day I just told him, honey, it's raining. And the man answered, is it me that said you should be ready? What's the problem? I just said it's raining. He said, maybe he has low T problem. Don't hang my head. I'm just trying to be naughty. Don't mind me. Okay? But the funny one out of all of this is the one called gynecomastia, oversized breast tissues. Do you know why? Because as testosterone drops, another hormone, which is more commonly found in women, called estrogen, rises. That's what happens during andropause. drop in testosterone, and sharp rise in estrogen. And estrogen, being a feminine hormone, can cause some men to develop feminine features. Now, this image you're seeing here, believe you me, is not a woman. Believe you me, it's one of the best images I saw online for gynecomastia. Can you imagine a woman going to buy her own bra and having to buy her husband's bra too? Very funny, but very sad. Yeah, let's talk to the woman now. Her nagging bedroom questions. I told you that I prepared for you today. A lot of women have questions in the bedroom. Like I put there, some bedrooms are full of questions. Few are asked, many unspoken. They just can't mention the problem. They have to eat it up. And it's caused by the prostate. No action in bed, caused by weak or no penis erection. And this image is very funny. Now look at the two images on the left, top left. That's what the man is showing the woman. Bottom left, that's the response of the woman. Top right, that's what the man is showing his woman. Bottom right, that's the response of the woman. You see, the prostate concerns you, ladies. Remember what I said in the beginning? That lady that said, what's my own with his prostate? Now you know that his prostate concerns you. So if you're not a smiling wife, let's help you bring the smile back. If you are not smiling, if you're a lady listening to me. Now I have this very funny image I saw online. I mean, it cracked me up. Now look at this frustrated woman. Look at what she said. Stop the screaming. If it works with cars, it must work tonight. Look at the exasperated look on the man's face. That's how frustrated some women are, you know. That's how frustrated some women are. So if you're not smiling, let's help you put the smile on your face. Then another area where the woman cannot talk. Look at my emoji there. When the penis is shrinking. That's another low T symptom. When testosterone drops, because testosterone has to do with penis size. So when a man's testosterone is low or is dropping, it can affect the size of his penis, both the length and the girth. That's the thickness. So penis size. I shared this image at a couple's dinner that I was invited to speak. I was invited to speak at a couple's dinner in a Redeemed church some years back. And as immediately I put up this second image, the image on the right, on the right of your screen. Immediately I put it up on my screen, you know, the couple that was sitting close to me in front, the wife just glanced at her husband. Oh my God, I was embarrassed on behalf of that husband because I caught that glance. She just looked at the man as if, you see your problem? So they even know your problem. She just gave, you know, that look. Oh my God, I had to carry my face away so that they would not see me catching that glance. But really, does size really matter? Women say size matters. Look at the man's look there. I was in Sheraton to do another seminar there, and we had a lot of guests there in those days where we were still doing live events, but now we're doing mainly online events. And I put up this screen and I decided to be mischievous that day. And I just asked, hey, can the woman in the hall give this image a better caption? Can we get a better caption than this image? The caption of this image, does size really matter? And one very cheeky woman stood up. Oh my God, I'll never forget that day. The woman stood up and said, yes, I can give it a better caption. Guess the caption she gave it. And you call yourself head of the house. Oh my God. If you see how all the women in the hall were just laughing. Not one single man joined in the laughter. We were very embarrassed. They were just laughing and laughing at us. I was embarrassed on behalf of all the men in the hall. And you call yourself head of the house. Oh Lord, I regretted asking for that caption. Anyway, it can be very embarrassing, you know. And look at the other image I have there. Just compare the expressions on the faces of these two women. Oh my God. See the woman on the right when they showed her the matchstick. Look at the image on the left when the man brought out his Hummer Jeep. Oh my God. And look at my emoji on top. No woman can complain. What do you want to complain? Are you comparing his own penis to whose own? Every woman must keep quiet on that. Okay, so let's talk about sex. I don't know why I'm feeling very naughty this evening. So let's talk about sex. Yeah, let's talk about sex. We have adults in the house. Let's talk about sex. So we're going to talk about some areas of sex that has to do with prostate problems, low libido, and weak stamina of the man. Look at my emoji. The woman is angry. Look at the wicked look on her face. She's waiting. The man has gone off. Is that your husband? Or maybe is that you? Are you missing in action in the other room? Look at the image there. That's how some couples are. Yet there's no quarrel, there's no fight. They're not having any friction. They just don't have sex. They can't remember the last time they had sex. That's the problem in many homes. The libido is on minus. Bedroom challenges continue. Has sexual frustrations and sexual desire disorders. When the woman is not getting action from the man, she goes dry too. Frigidity sets in for so many women because there's no action. What will she do? Will she go and start having sex with other men? Men do it, but women can't do it. Most women can't. So she's there, high and dry. Our problems give them problems. Then she starts a big fight. Then she believes it's the girl outside that is taking his attention. The man is having branches all over the country. I tell my friends this, especially the promiscuous ones, the men that philander a lot. I tell you, look, you are not winning home matches. You want to go and play away match. Home match is friendly match. Oh. If you lose friendly match, there's no problem. But you want to go and play away match, they will disgrace you. You better lose at home instead of going to lose match away. I warn my friends, stay at home. Don't go and have girlfriends outside. But really, that's the thing that women think. Not knowing that maybe the man's problem is not extramarital affairs. Maybe he's going through andropause. Just maybe. Hey, I'm not trying to excuse your promiscuous husband, okay? But just maybe. Have you given that a thought? Maybe that's why he's not responding to sex in the bedroom. Just maybe. Another problem with men and their prostate is when the sphincters don't hold and the man ejaculates before time. Remember, I told you the sphincter muscles control and they regulate the flow of urine and semen. Well, he's faster than Usain Bolt in bed, that is. Before she starts, he has finished. I call them the 2-minute no-do man. It can be very embarrassing and can be very frustrating for the woman. If that's your problem, please, let's talk. Or maybe you're experiencing painful sexual intercourse. Pain that begins before or immediately after ejaculation. Pain in the scrotum, in the shaft of your penis, in your testes, around your bladder area, in your rectum, deep inside your anus, you're just feeling pain. Pain during urination, especially after you have ejaculated. You feel this tingling sensation. A lot of men confuse that to be, STD. And I jokingly tell women, it's not every scream during sex that is out of pleasure. Please be very vigilant. Some may be out of pain. Be vigilant. Prostatitis may have set in. Prostatitis may have caused the urethra to be blocked. Let's talk about this thing I mentioned earlier about the prostate function of expelling semen. Remember, I told you the prostate produces the prostate fluid, collects other fluids from two neighboring glands and from the testes. Remember, I told you that it mixes all of them together and that it violently contracts and pushes the semen out of the urethra through the tip of the penis and into a woman. Remember, I shared that with you? Well, for some men, because their prostate muscles are weak, it cannot powerfully expel semen. So we find them releasing the semen in the peripheral outer part of a woman's vagina. And due to just sheer force of gravity, when the woman stands up, the semen leaks. In the part of Nigeria I come from, the southwestern part of Nigeria, we call the tribe the Yoruba tribe. We have this myth we call EDA, E-D-A, EDA. The myth says thus, that a woman that is experiencing semen leaks is actually having spiritual problem, that she has a spiritual husband, in quotes, who gets jealous of her physical husband while they have sex. So when they finish sex, the spiritual husband comes in and scoops out all the semen from her vagina. Don't ask me how that spiritual husband does that. The myth says the spiritual husband comes to scoop out the semen out of her vagina, and that's why the semen is leaking. So they call in a heavily anointed pastor to come and cast out those evil spirits. Heavily anointed, but heavily ignorant. The pastor is praying for deliverance for the woman, whereas it's the pastor that needs to be delivered from the spirit of ignorance. The problem is not from the woman, folks. The problem is because the man's prostate is not pumping the semen with enough pressure so that it goes deep into the woman. That's where the problem is. There's no spiritual problem. Don't make nonsense of a simple medical situation. There's nothing called EDA, please. I'm sure a lot of women will get delivered with this statement. It happens at all my seminars because they experience it and the whole family start looking at her, like we say in Nigeria, winch. They look at her with a funny look, possessed woman, especially if she has not started having children. It's because of her spiritual husband. That's why she's not giving us children. Poor woman. Not knowing that it's the man that has the problem, for crying out loud. So I came up with these few slides to explain how you should not have sex if you are experiencing semen leaks. You don't do the daddy and mommy style. No, you don't do that. You experience leaks that way. You don't lie on top of him. No, you experience leaks. Wisdom is profitable to direct. You don't do this kind of sex positions. Your prostate cannot pump deep and you're asking her to lie on top of you? No way. Well, what sex positions do you recommend, sir? These are the sex positions that are prostate friendly. They are mature adults here, so we can talk freely. It's called the doggy position, or support with a pillow, or just make sure that the force of gravity will make the semen go deep and keep her in a position where her buttocks is raised so that the semen will flow deep inside. These are just simple things that you use wisdom for. But please note, there's nothing spiritual about semen leaks. So let's stop semen leaks. Another area of challenge with women is this rising case of male infertility. Making babies is no child's play. And this area is very personal to me because I've gone through it personally. I've experienced challenge in childbearing, almost 10 years, and a lot of problem. I don't want to go into that. So I take this part of this training very personal. Anytime I meet a man that is having this challenge, I feel for him because I empathize with him. I know how it is when you're watching other parents that they got married long after you did, and you're watching them with their children, and you don't have anybody calling you daddy yet. I know how it is. When you go to naming ceremonies that are years younger than you, and everybody is praying for you, don't worry, you two will soon start having children. I know how it is when you are praying, when will I be called daddy? The time is now. I know today is a very important day to me too, because today is the day of my daughter's birthday, my first child that I waited years for. So wish my little girl, she's not a big girl, I'm 22 years old. Wish my little girl a happy birthday for me, okay? I dedicate today to her, she's my darling, okay? So I know how it is. I know how it is when you wait for long. So the time is now. Let's talk about having babies, if that is your challenge. Men's fertility issue is not just about sperm count. A lot of men, sperm count is so popular. Any problem, they'll say sperm count, sperm count. Yes, sperm count is part of it. The population of live sperm per ejaculate or per measure of semen. That's the one called the sperm count. But how about the others? How about sperm morphology? The percentage of normal sperm that have overhead and long tail. How about sperm motility? The percentage of mobile sperm cells that move in a straight line. This is not just sperm quantity, but sperm quality and sperm mobility. All of these have to do with sperm. But guess what? How about semen too? You talk only about sperm. Well, how about semen health? Semen health is important too. That's right. The prostate fluid. And the prostate does the job of producing the bulk of the fluid. So we're talking sperm health and we're talking semen health. And if that's your challenge, we can help you. So are you experiencing any of all of the things I've shared this evening? Does any resonate with you? If your answer is no, would you rather wait till they start happening? See, you don't wait till your car starts overheating before you know that you have to do something about the cooling system of your car. If you can be that careful with your automobile, how about your body? You've learned so much tonight. Would you wait until you start releasing blood with urine or with semen? Is that when you want to start taking care of your prostate? Listen to me, guys. We're not just going to talk about problems today. We're going to come up with solutions to these problems to help those who need help. And we have them in two main dimensions. First is preventive healthcare. The second is restorative healthcare solutions. So those are the two main dimensions that we're going to go with our solution strategy. Okay? So I saw this interesting quote online. I love it so much. I think I have it as an image there. Yes. Health is not valued till sickness comes. How true is that of we people? We wait until we lose health. Then we start running around to get it back. Why don't you maintain good health? Prevention is not just better than cure, it's cheaper and safer than cure. So if you're not troubled in any of these areas, thank God for that. Let's work with you on preventive prostate health care. If, however, you're challenged already in any of the ways that I've shared with the bedroom or the bathroom issues, let's talk about it and offer you a solution. Which leads me to the next point. When should you be concerned? When you see need for solution. This is when you should be concerned. You need to take care of your prostate. So a solution comes in three main dimensions. First is compulsory changes in your diets and in your nutrition. Second, compulsory adjustments in your lifestyle. Thirdly, a culture, that's the key word, culture of supplementation. Now, these are the three dimensions of healthcare for the prostate. And if you're not doing these three, you should be concerned about your prostate. You should be very concerned. So quickly, let's go through it as we close today's talk. Three sure ways to prevent or to check prostate disorders. Let's take the first one. Compulsory changes in your diet. Listen to this. If you don't eat your food as medicine, you're going to start eating your medicine as food. Like my dear friend there. Can you see his plate? Very delicious meal of pharmaceutical medication. Even his spoon is a thermometer. That's what's going to happen if you don't eat your food as medicine. You're going to start eating your medicine as food. So let me hit you cut and dry. You are what you eat. Is either you eat to live or you eat to die. The choice is yours. So, what foods, Boye, are good for the prostate? That's a good question to ask so that you can start eating them. Farm fresh fruits and vegetables is the very first option that you need to take care of your prostate. Farm fresh, key points. I'm sure wherever you stay, we have farms where you can buy them fresh. Okay, nutrients and vitamins are inside these fruits and vegetables, and they help to lower your risk of prostate disorders. They contain cancer-resistant substances. They're called carcinogens. They help to break down carcinogens that cause cancer in tissues. They break it down. They have these things inside them. Okay. Now, especially some particular types of vegetables. One of them is a family of vegetables called the cruciferous vegetables. That's the family name, cruciferous vegetables. Out of all of them, we have one called the broccoli. I have the image there for you so that you can see it. Broccoli is the number one. In fact, it's called the superfood. You can Google a lot on it, just broccoli for prostate health. I can do 2 hours teaching on broccoli alone. I've done a lot of research on it. How do you take broccoli? Just chop it into small bits, put water to boiling point, and dip it inside for about 2-3 minutes and bring it out and eat it fresh. You can use vinegar to wash it so that you can clear up all the bacteria in it. But don't cook for long, maximum 3 minutes. Just put it inside water and bring it out and chop it and eat it. Okay, very, very good for men. And it's a family of vegetables, like I said. It has some cousins, like the cauliflower, like kale. You know, those are other members of the family of the cruciferous vegetables. They're also good, but the best is the broccoli. Okay, one particular thing about broccoli is that it helps to break down estrogen. It helps to speed up that process. Estrogen is actually broken down by the liver. I told you estrogen rises in men and testosterone drops, and you don't need estrogen, okay? But the liver is supposed to break it down. But broccoli helps to speed up the process to break down estrogen, all right, and get your hormonal balance, in order. Well, another very, very good superfood is tomatoes. Tomatoes are very, 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 very good for the prostate. Okay, lycopene is a powerful antioxidant, but lycopene is adhered to the cell wall of tomatoes. Is bound strongly on the cell wall. So when you eat tomatoes raw, you don't even get the best of lycopene because your body cannot remove it very well from the cell wall of tomatoes. So tomatoes is not best taken raw. Process it a bit, steam it, give it light frying, then convert it to juice. Just add some value to it, or just process it a bit before you eat it. Tomatoes are very, very good for your prostate. Then we have foods that are rich in omega-3 fatty acids. These are anti-inflammatory. Omega-3 is an anti-inflammatory, so it helps to reduce swelling. Prostate, as you know, is an inflammation, so it's very, very good. We have sardines, we have the tuna, we have the mackerel, we have the trout. These are all fish that is very rich in omega-3. Then what do you have? Foods you should not eat. You don't need all these fatty foods. Please avoid these bad fats, this processed food. I have a quotation there. Some people dig their graves with their forks and knives. Don't be one of them. Please avoid all these bad fats, then all this fast food. Okay, I think I have another slide on that. Yes, all this beef, especially red meats, avoid it. Okay, avoid all of this high cholesterol food, fast food. Stay away from all these eateries, stay away from shawarma, stay away from pizza. All of these are very, very high cholesterol laden foods. Saturated fats, they call some trans fats. Okay, avoid those ones too. Then, your body actually produces cholesterol. Is produced by the liver. So don't worsen the situation by loading your system. Your normal body metabolism produces cholesterol. All right, so avoid all of this high cholesterol food, red meat, and a lot of eggs. Eggs are good, but just limit it to the barest minimum. Then lifestyle, compulsory changes in your lifestyle. Some people say they are chain smokers. I beg to disagree. They are chained smokers. They are changed to smoking. I mean, hey, when a manufacturer is demarketing his own products and telling you that he designed this product to cut your life short and you are still buying it, then there's a problem. You're not a chain smoker, you're a chained smoker. And cigarette is very, very bad for your prostate. And so is alcohol. Alcohol is not good for your prostate. Please stop it. Then, of course, fast food, get it out of your system. Then sedentary lifestyle, just sitting down, not doing exercise. Do some brisk walking. Instead of sending people on errands, walk. Instead of using your car, take long walks. My driver knows it. I will deliberately park in a place that is very far to where I'm going so that I will have to walk to and from the car. I do that deliberately because these days, because of COVID, I'm indoors most of the time. So I have little opportunity to move around. So instead of taking the car out, I walk long distance, and I do that deliberately, and so should you. I love this quote. Many live their lives as if they will never die, only to start dying as if they never lived. Please take it easy as you grow older. Okay, still on lifestyle change, learn Kegel exercises. Kegel exercises help to strengthen prostate muscles. Okay, you can go on YouTube, you'll see a lot of them there. Try to do those exercises. They help to exercise your prostate. Very, very good exercises to do. Then prostate screening, PSA test. Go and check for the PSA. And I have a word of caution on the PSA. Yes, PSA will give you an idea of the state of health of your prostate, but unfortunately, PSA is not an accurate measurement of your prostate's health. It only tells you whether the prostate is leaking PSA into the bloodstream. It does not tell you whether it has enlarged or not. Okay, and do a PSA scan. Okay, yeah. Then, of course, the physical examination called the rectal examination of the prostate, also good for physical examination of the prostate. Then we have the nutritional supplementation. Now, this is the part most people don't understand really. Why? Because many of the companies that make supplement, unfortunately, focus too much on the money making. And a lot of the people that market the supplement, I'm sorry to say, they don't really understand what they're selling. They just want to make money. So they cannot give you an in-depth explanation of how the supplement will help you. So that has given supplements a bad name, in quotes. A lot of people are very, very skeptical and even have an apathy towards supplementation. I did a seminar. One man told me, look, our forefathers didn't use supplements and they lived till 100 years. Why are you asking us to use supplements? You know, I said, yes, it's true. Our fathers and our forefathers didn't use supplements. But did you have factories in the village that was releasing smoke? Were there fast foods producing processed food? Were they using artificial manure and artificial fertilizers in those days? How can you compare life now to life of those times? Oh, the man was quite embarrassed. So I have 4 reasons for you why you should supplement. I'm not, I like to explain why so that you will understand the need for it. Supplements are just food repackaged in tablet form, simple, or in liquid form, so that you will get what you are supposed to get from food but couldn't in those supplements. They are repackaged food and fruits and vegetables. That's all. The nutrients. That's what supplements are. I can see from my 2 images there. Fruits and vegetables packaged in tablet form. So, first of all, soil erosion and bad cooking, bad modern farming practices have deprived the soil of the essential nutrients that your body needs. And I keep telling people, you say you take a lot of fruits. Okay, the soil that the fruit is grown on is lacking in nutrients. So where will the fruit get nutrients from? The man was just looking at me. If the soil doesn't have nutrients, how can the fruit grown on that soil have nutrients? That's it. So soil erosion, bad or modern farming practice, has eroded the soil. And do you know what? You can verify this fact too. There are some parts of the world that are naturally deficient in some nutrients. Please go and confirm this. Take the nutrient called iodine. There are some parts of the world that naturally the soil there don't have iodine. Africa is one soil. Very little iodine in Africa. No wonder we have the incidence of goiter very high on the African continent because our soil is deficient naturally. I'll give you another one. The Eskimos. Those are the people that live in the Arctic Sea region of the world. You know, that's the Eskimos. The fishes in the Arctic Sea region of the world are known to have the highest level of omega-3 fatty acids. Eskimos have the lowest incidence of heart problem in the entire world. Empirical evidence prove that, and you can go and confirm that yourself. So you can see in one part, the deficiency of nutrients is causing health challenge. In another region of the world, the natural habitat of the fishes there is giving the Eskimos excellent heart health. That is what is happening. Nutrient deficiency of the soil. Okay. The second one, bad or modern cooking practices. See, the bleaching of sugar, already removes all the nutrients. Bleaching process of bread removes the phosphorus and the manganese from it. Cooking, overcooking of vegetables kills all the nutrients. Many of us just eat vegetables that don't have nutritional value. Okay? The third one, self-poisoning. We poison ourselves. Many of us take energy drink that is very, very high in caffeine. You see me taking energy drink. This one is free from caffeine. And I need energy because I do a lot of thinking. You see people sitting in office on the same spot from morning to evening. They are more tired than the person doing manual labor. Do you know why? Because the brain cells consume a lot of calories. And that's why I take energy drink. And I can't take the one that is high in caffeine because I know it's not good for my prostate. So I take the one and that's part of poisoning. A lot of us take all these toxic drinks, all these processed fruits, because they put a picture of pineapple on that fruit juice. You think it's pineapple, it is just chemicals that taste like pineapples, not the real pineapple juice. Okay, I'm not demarketing them, I'm not mentioning any company, but most of these popular brands of fruit juices don't contain the juices. If they do, contain very little. The rest is chemicals that tastes like that. So we have self-poisoning and we have food poisoning, bad choices and chemicals in foods. The last reason why you should take supplement is because of environmental pollution. Some parts of Nigeria, they are suffering from extreme environmental pollution in the southeastern part and the southern part of Nigeria because of the oil processing there. The air is so choked with toxic material that they are having a lot of respiratory problems there in the southeast and the south part of Nigeria. I was in Port Harcourt some years back, I remember. They said the next morning they were to take me out in the car, and it was a white car the previous day. By the next morning, this car was gray. And I was telling my friend, wait a minute, what's wrong? And they were laughing. So this is Port Harcourt. I said, I should be laughing at you. You are laughing that I'm surprised. The suit, black suit, had covered the entire car. A white car had turned gray overnight. That is how bad it is in some parts of Nigeria. Okay, so environmental pollution in the soil, environmental pollution in the sea. The fishes are dying because of chemicals, oil spillage, all of this stuff pollute the soil, pollute the environment. We have herbicides, we have pesticides, we have insecticides that pollute the environment. And all of this make it mandatory for you to use supplements to put back inside your system what you are supposed to have gotten, then put in your system what you fight and break down all these toxins. So you know why you should use supplements. Well, what is our approach? Our approach of nutrition for prostate health is as follows. Enzyme. For those of you that have science as your background, the conversion of testosterone to dihydrotestosterone is done by an enzyme called 5-alpha reductase, which stubborn. Now, when less DHT is formed, we now boost fresh production of testosterone. So less DHT and more testosterone will naturally make your prostate stop enlarging and shrink back to its normal size. Then we have a combination of powerful antioxidants that help to, like I explained to you, stop the electron stealing and donate their own electron to settle the quarrel. So it stops cellular damage too. Then the nutrient help to clean out your system and make your prostate have the right combination, the right concentration, in the right synergy to give you excellent prostate health. That is the modus operandi of our approach to prostate health management. How about sexual health? Well, The first thing about sexual health you need to realize is that it's controlled by testosterone. So by boosting testosterone production, and that's done in the testes with nutrients from the supplements we're going to recommend for you, it will help to improve testosterone production. Now, of course, when testosterone is improved, it affects your overall sexual health. Then the second approach is to introduce aphrodisiacs. Now, what are aphrodisiacs? Aphrodisiacs are substances that promote sexual appetite, desire, and stamina. Now, aphrodisiacs are of two main types. We have the synthetic aphrodisiacs and we have the natural aphrodisiacs. The synthetic ones are the ones produced by pharmaceutical companies. They call them the blue pill. I do not recommend that for anybody to use. I'm sure many of you have read so many stories online of so many men that have taken this blue pill and actually died on top of a woman. My very good friend of many years lost his life this way with his girlfriend in a brothel. The brothel was even in his neighborhood. So I know, and I've read stories. So I don't encourage people to use synthetic aphrodisiacs. Some of them cause priapism. Priapism is an unnatural penis erection that is not caused by natural sexual stimuli. Priapism can give you an erection that will last for 2 days. I was in my friend's clinic when they brought a 17-year-old boy that had a 2-day erection. They will cut that penis so as to leak the blood away. It's because of all these artificial aphrodisiacs, all these Chinese tablets, all this blue pill. We do not recommend that. The aphrodisiacs I will recommend to you are the ones that are backed by science. Don't take my word for it. You can go and Google it yourself so that you will see that these are science-backed aphrodisiac, safe, natural substances from herbs and plants that is known by science to improve sexual appetite, stamina, and moods. Then finally, erection is caused by a flow of blood to the penis. Erection is maintained with a strong, healthy prostate. So we will help you improve the strength and the health of your prostate. Then we will help to improve blood circulation so that more blood will flow to the penis. See, if you don't have good blood flow to the penis, you can't have an erection. It will not last. So we will help to improve blood circulation all over your body so that your system can now push blood to the penis and stay there throughout the duration of your sexual encounter. Okay, so that is our approach to both prostate and sexual health. I'm not about marketing of products here. We have taken time to understand how these things work so that we can guide you and give you a solution that is tailor-made just for you. I know a lot of people have met people marketing all sorts. Listen to me and listen good. There's no tailor-made solution. It's a solution package made just for you. What you need to do is to get back to my partner who invited you here today, or if it is me that invited you, get back to me and we'll be able to discuss your specific needs based on your specific challenges, if you have challenge. And if not, then we'll be talking about preventive prostate health for you or sexual health, whichever one. Okay, so that is the approach to prostate and sexual health. So out of all the manufacturers of supplements, we have reviewed all of them and we have found one particular brand to have done the necessary due diligence in the research and development of their supplementation for prostate health. Because I know the nutrients that the prostate needs, I'm looking for the brand that will give me the correct bouquet of nutrients. I'm not here selling a brand name. It is what the supplement contains. I use the analogy of a football team manager that wants to kit his players. Now, I'll go to Nike to go and buy jersey. But sorry, Nike doesn't do shorts. So I have to go to Puma to buy shorts. Well, sorry, Nike and Puma, they don't do the socks. So I have to go to Adidas to buy socks and boots. So I kit my player with products from different manufacturers. Well, is there a manufacturer that makes jersey, shorts, boots, socks, football, everything I need for my footballers? Yes. I have found one in an American multinational called Forever Living Products. And the beauty of this company is that they have local presence in 160 countries of the world. So if you're listening to me, you are in a country where this company have an operating office. And if you are on this platform, it means that you were connected by one of my associates. It means that through that associate, you will be able to access these products directly from the manufacturer in your country, wherever you are from. You will get back to the person who invited you here today, and they will be able to help you access these items. They know the correct combination of the different products to give to you. I will just run through these items, starting with the number one product for prostate health called Vitalize for Men. It contains all you need for your prostate: vitamin C, D, and E. Very important minerals like selenium and zinc. Okay, lycopene is also there. Okay, and we have a lot of like the African pigeon, for example. That's even from Africa, from a South African plant. It's called the African pigeon. It's very good for the prostate. Saw palmetto is also very good for the prostate. Pumpkin seed. All of these are very, very, very good nutrients for your prostate. And all of these are packaged inside this fantastic product called Vitalize for Men. That's the number one product for prostate health. Listen to me and listen good. If you're not using anything at all, please make sure you order this one. Well, we have some others. We have additional products, the Arctic Sea Omega-3. Now, the name Arctic Sea Omega-3 tells you where they source their Omega-3 from the Arctic Sea region of the world. Remember, I told you the fishes in the Arctic Sea have the highest level of omega than any other fish anywhere else in the world. And that's where this company sourced their omega from the fishes in the Arctic Sea region of the world. Then we have the propolis, which is a very powerful natural antibiotic. We have the pollen. Pollen is excellent for the bladder. Don't take my word for it. Just type it on Google. Bee pollen and prostate and bladder. Just type it on Google. Don't take my word for it. Then we have this powerful antioxidant formula, the A beta care, that's the vitamin A in the beta carotene form, and vitamin E. These are two important vitamins that are powerful antioxidants. I told you all about antioxidants. Okay. What else do we have there? Then we have the drinks. We have this called the aloe berry nectar. Now, this comes from the real raw cranberry juice. Now, cranberries are well known to clean the bladder. It's excellent for bladder cleansing. Go and Google all what I'm telling you. Cranberry juice and bladder. Just type it on Google. You will see all what I'm saying as confirmed fact. Now listen, this is not cranberry flavor. This is raw cranberry juice. mixed with apple juice. Now, apple juice has pectin, which is also very good to clean your urinary system, okay? And it also has nectar in it. Then we have this excellent antioxidant drink called pomestin. Sorry, I missed the spelling. There's no R there. Pomestin power. Pomestin is a combination of the juices from two fruits, pomegranates and mangosteen. Pomegranates and mangosteen. These two fruits have very, very high antioxidant power. In fact, they call the ranking of fruits in terms of their antioxidant strength. They call it the ORAC rating or ranking, ORAC ranking. These two fruits are in the top 3 in the ORAC ranking of fruits that have antioxidant power. Now, they are combined together with other the juices from the raspberry, for example, and other berries, put inside this very, very concentrated mix that you don't even take it raw. You have to mix it with water to taste. You don't take it because it's so concentrated. It's a very powerful. I don't miss it every evening. I take it. Okay, just a little quantity inside a glass of water and drink just like that. Then we have the number 1 flagship product of the company, the aloe vera gel, which helps to detoxify and provide a rich cocktail of nutrients and vitamins and so many other, over 200 nutritional compounds are inside that beautiful drink called the aloe vera gel. Okay. Then someone like talking about cholesterol and the Arctic Sea omega-3. If you get in touch with any of my partners, they'll share a video demonstration that I did, 9-minute video on this product called Arctic Sea. I so much love this product, because due to lack of knowledge, we've consumed a lot of foods and drinks that are heavy in cholesterol. Okay, so some of us have to clean our system more vigorously than others because of the kind of foods and drink we've taken in the past. So I take this Arctic Sea religiously, believe you me. It helps to break down cholesterol and free my arteries of all the clogs. A lot of people think that it's only fat people that have cholesterol. See, bad cholesterol doesn't show in front of a mirror. That kind of fat, you won't see it in front of a mirror, believe you me. It's inside your blood vessels. When we do a teaching on heart health, you'll be invited and we'll talk more on that. Don't let me talk too much on it. I just get carried away anytime I talk about this. Let's talk about can't get it up. The man downstairs, the staff of office. Yep. The number 1 supplement for sexual health is this mix called multi-maca. That is contains maca, but more than maca. It has a lot more nutrients so that you can rise to the occasion better with the multi-maca. It has, that's the maca there, you see there, Peruvian maca. It's called Peruvian maca because it's grown mainly in the country of Peru. Peru is in the Latin America area, South America, okay? Maca is so popular there, they named it with their country. They call it Peruvian maca. People from Peru have the highest level of fertility in the world. And it's because they take a lot of maca. It's like a root, that's it there. Then we have this ginseng. Ginseng is also known to improve sexual performance, especially stamina and libido. So combined together, we have a product called the multi-maca and another one called the gin chia. Chia is from the plants, small plants, the Chinese chia, small seeds. It's also a very powerful aphrodisiac that will help to improve sexual appetites and moods. Then we have others for sexual health, and I want to just quickly go through them. One is called the Ginkgo Plus. It's from the plant called Ginkgo biloba. Ginkgo biloba is a plant that helps, well known by science, to dilate blood vessels. Dilate means it gets fatter in diameter. Now, when blood vessels get dilated, they carry blood more. And of course, improved blood circulation will help with penis erection. Then we have AG, this wonderful product called AG Plus. Is a product that is rich in the amino acid called L-arginine. L-arginine is a very important amino acid, but unfortunately, as we grow old, our body's ability to produce it diminishes, so that when we get old, we cannot even produce it anymore. Yet we need it for excellent heart health and also to improve blood circulation. So we find out that this particular product is so good that it is endorsed by no other than the Nobel Prize winner, the 1998 Nobel Prize winner for medicine. His work, his research work that earned him a Nobel Prize was on the role of arginine for heart health. And this company took this product to him, and this man attested to it that this is the best nutritional supplementation for L-arginine in the world market. Again, don't take my word for it. Just go on Google on your phone and just type these words: FLP product and Nobel Prize winner. Don't even mention IG Plus. Just type FLP, that stands for Forever Living Products. FLP product and Nobel Prize winner. Ladies and gentlemen, you will watch YouTube videos where a Nobel laureate put his Nobel honors on the line to confirm and attest to it that this is the best product for L-arginine supplementation in the world. I mean, I'm talking about quality products. I'm not talking about come and do. No. I'm talking about what the products contain. That's why I put my, you see, because my own integrity is so important for me. It's more important than money making. Okay? The Bible says a good name is better than riches. I want to recommend something and I want my integrity to be intact. So I'm not really into the money making, come and make money. No. Look, use these products, it will work, and you will come and thank me for it after. And because I understand the products, I know the right combination that will help get you the best result. And of course, the bee pollen is also there too. Well, for sexual health and fertility, we have a combination of different products that will help to improve sperm production, we improve semen health too. We also help with the woman's reproductive health, her hormonal system, and all of that. We have a range of different products for that too. Okay, so number 10, the last point. Why should you be concerned? You should be concerned about your prostate if after listening to today's presentation, you leave this place and say, I'm still thinking about it. You will leave today and say, wow, that was a good presentation. I really learned a lot. Excuse me. Thank you for your compliment, but I'm not a lecturer, please. I'm not here to give an interesting lecture. If after listening to me today, it will not move you to take action, I'm sorry, you've wasted your time and mine too. It serves no purpose. You said knowledge is power. I beg to disagree, sir. It is the application of knowledge that is powerful. It's not just knowledge. So today I have given you knowledge, but if you don't apply that knowledge by taking action, then it's a waste of your time and mine. So what am I trying to say? Leave that thinking position, like my guy, the statue there. He's still thinking about it. If you don't have questions or you're not going to take action, you should be concerned about your prostate. Move. Be like the doer. And what action must you take? Get in touch with our associate who invited you here today. Now, the person who invited you here today, it may be somebody you know already, which is good. Get back to him or her. However, many of us that invited participants today don't know them. If you saw an advert on Facebook, there's certainly a phone contact there. If you saw the flyer on a WhatsApp group, there's certainly a name and a phone contact there. Get back to that person. That person must have put a phone contact and a name. That's how we trained all of them. They must put a name and a phone contact. If it was Boye Abe you saw on the contact through any of my different phone numbers, I have quite a number of numbers, okay? Then let's talk after. Do you want my number? I'm sorry, I cannot give you my number. But the only people that have my number are the people I invited. So if you got an invitation and you saw the name Boye Abe on it with a phone number, get back to me. If you saw any other name on the invites that got you this Zoom link, please get back to that person. The person is part of our expanded organization here in Nigeria or anywhere in the world. We have people that logged in from so many African countries, and we're going to run international conferences like this on different areas of health. The next topic we're talking about is on menopausal health and women's sexual health. No, I'm not the one going to talk about sexual health of women. So we have women who are going to take care of that. We're going to talk on different areas. We're talking on heart health. We're talking on arthritis. We're talking on sugar crisis. We're talking about different areas of health to be able to help our people. Okay? So there's a lot more that we're going to do together. So let's start with this and get it right. Please get back to our partner. We have them in your country if you're not in Nigeria. If you're in Kenya, we have a solid friend there, Madam Josephine. So many of our people are also in Kenya. I have personal friends there. I have business associates there. And I've made new friends in Kenya too, and some other countries, Cote d'Ivoire. And so many of our associates too have invited people from within Nigeria and from outside this country. So please make it a point of duty, get back to that person, him or her, who invited you here today by checking the phone number and the name that you saw on the invites that got you to this platform here today. The summary of what we offer you, that is my partners and I, we have 100% organic, safe nutritional supplementation for prostate and sexual health. Then we host prostate and sexual health seminars, and not just prostate and sexual health, different types of seminars on health topics. We can host one for you exclusively for your group. If you have a group, you have a club, you have an association, we have a group of people you want us to come and speak to, we'll do one for you live. We do it on Zoom. We also do it on WhatsApp. My partners and I, we will organize, just talk to them, and we'll be able to arrange something together. Then we offer professional nutrition management and support for you, not just to sell something to you and disappear. No, we want to stay with you and help you manage your health and help you maintain good health. So these are the three areas. And of course, if you have need to get medical attention, like one elderly man, he joined my Zoom. They told him all the while that it was his diabetes that was causing him to urinate frequently. And as he was listening, he said, look, these are all the problems he was going through. And they kept on telling him that it was his diabetes. And he has spent over 300,000 on that. So when we met, he showed me his PSA test, excellent PSA test result for a man in his 70s. But he was having serious prostate enlargement problems. To cut a long story short, I referred him to a urologist. Do you know what? They drained over 3 liters worth of urine from his bladder. Over 3 liters. This man was just praying and thanking me for saving his life. So if there's need for you to get medical care, so please let us know. We'll also connect you with our partners who are also medical doctors. Okay, so these are the areas of reference where we can partner together and help. And if you can smell the money, this is not for everybody. If after listening to all what I've said, your nose can smell money, out of all of what I've shared today, please talk to our partner. They will tell you the money-making part of wellness. And I will help you see how you can earn income digitally. Digital marketing and social media marketing. These are skills that I teach, and we'll be able to show you how you can leverage on digital tools, you can leverage on social media and make money. If you're listening to me today and you saw an advert on Facebook, somebody got the skill to be able to help you see that advert. Can you learn that skill too and make money with that skill? Like I said, this part is not for everybody. It's only for those who can what? Smell the money. My own nose is trained to smell money. I don't know if yours can smell the money. As you can see, the money is also in some currencies that are hard. They call it hard currency. That's some of the monies that we're talking about. So if you like that part of this, hey, get in touch with our partner and he will tell you the business of wellness. That's the business. Okay? But that is not for this discussion. But if you're interested in that, let's get on with that. So I close with this. Protect your vital equipment, or if you're a woman, protect his vital equipment. You can't get a replacement, though. Please protect it very, very well. So thank you very much for listening. Go get preventive or restorative process solution through our associates who brought you to this event today. And if the person that invited you, if you check that invite you got and you saw Boye Abe, Boyeabe, get in touch with me through whichever means I invited you here today. But if it's for any of my partners too, please get in touch with them. We need to hear from you. Don't just leave today and say, wow, powerful presentation. I appreciate that, but I want more than just a compliment. I want you to take action, okay? So thank you very, very much for watching this presentation, for reading, and for listening to our presentation. In the next 2-3 hours, we will have it on YouTube, and we will send the links to all our partners so that they can share the links with you, okay? So you'll be able to, because we're actually doing it live on YouTube now. Yeah, my technical director just reminded me. Don't mind my Bushman. So my technical director told me we're doing it live on YouTube, so it's going to be ready immediately, okay? So you will be able to get the link and have it and share it, but get back to our partner so that they can share the link with you. Of course, at the end of today's meeting, I know how to get in touch with all my partners. We'll give them the links and they'll be able to send it to you. Wherever you are in the world, this is Boye Abe saying thank you very, 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 very much. We're really, really so grateful. We'll tell you the dates for our next event. We're hoping within the next 2 weeks, we should be ready for our menopausal and sexual health for women seminar. Okay? Well, we can't take plenty questions, sorry. And I don't want to make the mistake we made the last time by allowing everybody to speak. Some funny people just spoiled the whole thing last time. So we'll just give room for just 3 questions, okay? Please take the rest of your questions back to our partner. I keep saying that. They're the ones that made today possible. It's not just me. I'm just their errand boy to do the talking, okay? My partners made today happen. And I want to thank all of you, my wonderful associates and friends within Nigeria, especially my international partners from Kenya, from Cote d'Ivoire, from Ghana. I have 1 or 2 people from South Africa, and my friend from Dubai is always here with me. I appreciate you and your group. Thank you so much for always logging in and being part of all we do. Okay, so just raise your hand. If you look at your device, you'll see how to raise your hand. We will just select 2 or 3, maximum 3. We don't have too much time to take too many questions, but I'll just check now. Come and help me set that out now. So we'll take your questions now. I'll just stop sharing the screen so that we can take your questions. Okay. So please, let's take a few questions, 2, 3 questions, not much, so that we can call it a day. All right. Let me, yes. We'll just check which hand is raised. Just hang on. Check. All right. We are. Okay. Is this the YouTube on? Can you stop the YouTube? Stop the YouTube. Okay. The YouTube is still clean. Okay. I can't unmute everybody, but I will unmute a few people. Mr. Salisu Umar Ibrahim, your hand is raised. Mr. Salisu Umar Ibrahim, I will allow you to ask your question. I will unmute you. Let me control it, please. Only him. Yeah, just unmute him. Only him. Yes. Okay. Now, Mr. Salisu, you can unmute so that we can hear you. Mr. Salisu, ask your question.
I don't have a question. I just want to commend. I want to commend your efforts.
Thank you very much.
You're doing a great job. We appreciate you. Thank you for the presentation.
I'm listening to you, Mr. Salisu. Please hurry up, ask your question.
I could have one question. I was just asking you. Commend your presentation.
Okay, you just raise your hand. Okay. Oh, yeah, put him back. Put another person. Just put another. I just want to take maximum. Mute him back, please. Tolu. Okay. Wait. Okay. Who is that? Who is the person? Who are you mentioning? Huh? Who is the person? Okay, Tolu. Tolu, please ask your question. We have unmuted you.
Hello.
Mute back, Tolu. Mute back, Tolu.
Hello. Hello.
Go on.
Tolu, please, go on.
Okay, sir.
Good evening, Tolu.
My question is that I knew someone that did a prostate enlargement surgery, but can the issue still reoccur again in the future?
Well, if you have done a surgery of a part of the prostate, we can still have need for it in the future if the growth is still there.
Okay, thanks, sir.
So, in my own opinion, the surgery is the last resort. I always advise every other thing apart from surgery.
Okay, sir.
So Tolu, please mute back your mic. Let ask somebody.
But thank
Adiza Abubakar. Adiza Abubakar, you're on mute.
Adija Abubakar, please ask your question.
Okay, sir. Good evening, sir. Thank you
Yeah, good
very much.
evening.
Thank you very
Thank
much
you.
for the training. We really learned a lot. My
Thank you
question
very
goes to
much.
the product, sir. As we don't have the Junko and Ginchia now in the country, what are we going to recommend attached with the product that you recommended?
Okay,
Since there
which
is no
country are you
Junko,
first of all? Which country are you in?
I'm calling from Abuja,
You are calling from
Nigeria.
Abuja. Okay.
Yes.
Okay, don't worry. Get back to our partner. We'll give you an alternative of what you will use. Our
Okay.
partner will give you an alternative of what you will use.
Okay,
Mute
sir.
back your mic, please, so that we can take last question.
Okay, thank you, sir.
Next person. Hmm? Hmm?
We don't have anybody who will answer. No other person. Adiza solution. No.
Who's
No more answers. We are taking this. We are taking this.
who's the next person?
No other person. We are just taking. We are taking that. No other person is available here.
All right. We've taken 3 questions. I think that should be all for now. Please please mute back your mic, Adija, please, so that you don't disrupt. So thank you so much. If you have any further question, please get back to our partner who invited you here today, so that you'll be able to get the solutions that you want. I want to thank you so much for your time today. I have 53 chats. Have you done the screenshot of this one? Yeah, so we'll be able to just round up the meeting now in the absence of any other discussion, so that we can. Have you done the screenshot?
You can stop the recording and go.
Okay, so thank you so much, everybody. We are rounding up now. The recording will be available to our partners in the next few minutes. If our partners are here listening to me, please get in touch with me so that I can send you the link to get the YouTube recording. I appreciate your presence tonight. Have a healthy prostate and have a good evening.